The discussion about when to reopen the economy often comes down to testing for who has antibodies against COVID 19. But some researchers at the forefront of developing an accurate test say it's too early to pin all our hopes on science finding the right test soon. NewsHour Weekend special correspondent Simon Ostrowski has our report.
This is the type of testing site that's widely available across the country now. The testing kits that they have here can only tell you if you've currently got COVID-19, but researchers want to develop antibody tests that will be able to say if you've ever had the disease and hopefully that you've reached a certain level of immunity and it's safe to go back to work.
A team of scientists from the Reagan Institute of Massachusetts General Hospital, Harvard, and MIT are working overtime to create just such an easy-to-use test, known as an assay, for COVID-19 antibodies that could be mass-produced.
And that really is the ultimate dream of where we're going to go with this assay.
Although many coronavirus antibody tests exist already, the current generation can only tell you if you've been sick before, not if you've achieved immunity.
These are the labs where we do all the work, and so you can see here these are all multiple BL2 containment facilities.
Galit Alter, who's leading the Reagan Institute's project, says she's a month to half a year away from having a test that could tell us if it's safe for people who've already been infected with the coronavirus to go back out in public. That's a timeline that's shorter than what it'll take to develop a vaccine, but a longer wait than President Donald Trump's administration would like to restart the economy.
People would like to have these point-of-care tests available to them at the pharmacy where they can basically, test if they have antibody or not. And the concern is that, just having antibody is not going to necessarily be a certificate of protection.
Before we jump on that boat and say that if you are positive for antibodies, you can go back to work, we have to better understand what exactly the antibody test means.
Michael Mina is a Harvard professor who's also working on the project. He said it's just as important to find out whether people who have antibodies can still be spreading the virus.
We really want to create a test that's looking for very specific antibodies that have a chance of reflecting whether or not somebody is truly protected.
In order to figure that out, researchers are going to need to track recovering COVID patients for weeks or even months, sampling their antibody levels periodically along the way to correlate the readings to their ongoing state of health and the health of those around them. The Institute is in the early stages of this work, tracking groups of patients from hospitals in Massachusetts. Researchers, though, are uneasy about the message the public is getting from the federal government.
They have immunity if they've had the virus. A lot of them don't even know if they've had it.
Alter is concerned people could come to believe that simply having a test that shows they've had the virus will lead them to believe they're now immune. That's something that's still unknown, and she doesn't want members of the public to get a false sense of security that might lead to dangerous behavior, spreading the virus even further.
And that's why returning antibody data back to people has to be returned with that type of counseling associated with that report. Right. So that people understand, yeah, you have an IgG titer, but that doesn't give you that, carte blanche that you can go back to work because you can still be a super spreader.
The state of Massachusetts is taking a conservative stance on the promise of antibody testing and said it's reviewing its potential. In a statement to NewsHour Weekend, the state's Department of Public Health said antibody testing is still an area of active scientific investigation, and we still don't have a very good understanding of the antibody response and its temporal relationship to infection or to immunity. We certainly don't yet know the duration of immunity to COVID-19. The good news is victims of past coronavirus outbreaks have developed immunity. Robert Davey is a Boston University researcher who's working to find a drug therapy for COVID-19.
There's a lot of evidence that people who have been infected by other viruses similar to this have sustained immune responses, have good antibody levels for a long time after infection, and those protect them against being reinfected by the same virus. But we have to learn, we're still in the learning phase to know if that's true for this particular virus, but it is likely.
In the meantime, the Reagan is partnering with MIT and Harvard's Broad Institute to ramp its antibody testing capacity up to 10,000 samples a day, in the hopes of conducting a study of New England and beyond that will tell us what percentage of the population has experienced the coronavirus. But Alter says much more needs to be done for them to be successful.
It's this issue that there's no coordination from the government to bring the right thought leaders together, to bring us closer to the commercial partners who can make these types of tools at a level that can really respond to the needs of the population.